Welcome to Double O Kidney. If you are new here, my name is Catherine and I've been working with kidney disease patients for almost 10 years now. And if there is one thing that can make all the difference between ending up in dialysis and reversing kidney disease, it's proteinuria levels. Proteinuria levels can actually tell your future. Fact: having unusually high levels of protein in the urine means your kidney function is going to get worse fast. And while for those without diagnosed kidney disease, seeing a foam in the urine means that their kidneys are actually being damaged, the best nephrologists actually use proteinuria levels to reliably predict if a CKD patient will have kidney failure in the near future. Yes, this level here is even more important than GFR or creatinine when looking at your analysis. So next time you get tested for kidney function, pay special attention to your ACR and your proteinuria levels, no matter what stage of CKD you may be in. And guys, there are powerful natural remedies, medications, and good habits to lower proteinuria levels fast and avoid dialysis. Actually, I want to start by showing you some foods that you should eat more often if you want to fight proteinuria and improve kidney health. Number 5, eat more often walnuts. Oh, I love walnuts. This tasty snack is so rich in antioxidants that it may even help prevent heart disease and cancer. Also, there are studies confirming that diets enriched with walnuts led to lower cholesterol when compared with other diets. And this is really important if you have kidney disease, because taking care of your heart means taking care of your kidneys. And while you may get this health benefit from other nuts too, walnuts are the nut with the greatest omega-3 fatty acids content. And also consider flax seeds. This is a superfood with powerful anti-inflammatory benefits. According to studies, flaxseed can actually improve kidney function in those suffering from inflammatory kidney disease. But everyone should consume flax seeds. Just like walnuts, this is a great source of omega-3 fatty acids. And omega-3 fatty acids are key to fight proteinuria and avoid dialysis. And maybe the best vegetable source of omega-3s is chia seeds. The chia seed is a tiny little powerhouse that can add a lot of benefits to your diet. Eating these seeds regularly may actually help improving your heart health, lower your blood sugar levels, and protect your kidneys from proteinuria. Now, what makes chia seeds one of the healthiest foods you can eat is their omega-3 fatty acids content. This benefit alone is worth including them in your renal diet. Yes, all these foods are very rich in omega-3 fatty acids. That's why they can protect your kidneys from proteinuria. And adding more omega-3s is really good for your kidneys. Actually, the whole premise of today's video is that lowering your proteinuria levels, or ACR, will significantly slow down the progression of kidney disease. And it brings us closer to our ultimate goal, avoiding dialysis. And guys, this is actually amazing! However, you should know that while the foods I've shown you are very healthy and they have proven benefits, patients in these studies actually needed to also supplement omega-3s. So you will actually need a higher dose of omega-3s than what you may get from foods to achieve the result. I've shared the best dosages and all you need to know about omega-3s in my video up here if you want to know more. But don't go away yet. Our next remedy is a vitamin that's actually proven to help you slow down kidney disease and decrease proteinuria levels almost immediately. This is a very cheap, easy to find supplement that can actually save the life of people with kidney disease. Before I show you what it is, there is one easy tip to greatly lower proteinuria and protect your kidneys you should absolutely know about. Very important tip! If you take a blood pressure lowering medication, be very careful with the medication you are taking. There is a lot of buzz surrounding blood pressure medications these days, and patients should be extremely cautious and double check what their doctors are prescribing them. This is what medical newspapers recently headlined. Common hypertension drugs can cause kidney damage. Are you affected? This is the headline on The Express, a major British newspaper. A recent study found out that people taking a certain blood pressure medication are actually damaging their kidneys instead of protecting them. Yes, you hear this correctly. I've been saying this for years and now I'll repeat it. If you want to be safe from a potentially lethal medical error, you need to double check everything your doctor prescribed you. This is why getting informed about your health, like you are doing right now, is one of the best things you can do. Not all the blood pressure medications are going to protect your kidneys from proteinuria. Some will do this and some won't. Beta blockers, for example, are not a good first-line medication for high blood pressure in those with proteinuria, and yet they are often prescribed. On the other hand, if you get your doctor to prescribe you angiotensin receptor blockers, or ARBs in short, this medication will actively protect your kidneys from proteinuria. Because while all blood pressure medications work to lower blood pressure, are the most powerful type of medications when it comes to protecting the kidneys. So be very careful with the blood pressure medication you take if you have proteinuria. Time now to see a vitamin that is actually proven to help. Researchers have recently discovered that there's a vitamin that can significantly reduce the severity of proteinuria among patients with CKD. Actually, every single kidney disease patient should be supplementing this one. Deficiencies are extremely common when it comes to number 3, vitamin D. Vitamin D really is the kidney vitamin. Low vitamin D levels have been linked to fatigue, frequent infections, bone pain, a dozen other nasty symptoms, and a faster decline in kidney function. And getting vitamin D levels back to normal can help fight diabetes, lower blood pressure, and also protects the kidneys from proteinuria. This is extremely important because, as we have seen, means the risk for dialysis is now lower. But wait a moment before starting to take vitamin D3. There is a hidden risk connected to this vitamin very few people know about. Because while taking vitamin D3 in the recommended dose of 25 micrograms per day works for some, unfortunately, some others may have vitamin D deficiency even when they supplement it. So guys, supplementing vitamin D really is crucial for good kidney health and proteinuria levels. Time to see our number 1 now. And guys, the good news is that our number 1 for today can seriously help you lower this crucial level. This is an incredible remedy with powerful documented benefits. According to a study published on a respectable peer-reviewed journal, taking this natural remedy for 3 months is enough to obtain a reduction of 36.7% in protein in the urine, or albuminuria. Guys, before I show you what it is, there is one thing we absolutely need to clear here. As I was saying, your doctor may use ACR or urine albumin to creatinine ratio to predict the health of your kidneys in the future. But wouldn't it be even better if we could do this prediction by ourselves? Let's see how this works. How to read your ACR levels. Also known as albuminuria or proteinuria, this is one of the most important markers of kidney damage. It's usually indicated on your blood analysis as ACR, but you could also find albuminuria. This level is just as important for those with CKD as for those who are at risk for CKD, maybe because they have diabetes or high blood pressure. This table here explains it pretty well. What it tells us is that the lower the albuminuria, the lower the chances of progressing to a worse stage of kidney disease. And this is always true, no matter what stage of kidney disease you are in. So if this level is below 30 milligrams per gram, you're more likely in the green. Your kidneys are going to be stable in your current situation. If this level is between 30 and 299 milligrams per gram, you are risking that your kidney disease will worsen. In this case, you are in the orange or red, depending on the stage. Now, when this level is over 300 milligrams per gram, being in the red is a reason for concern. In short, keep albuminuria or ACR under 30 milligrams per gram in all the stages of CKD to slow down CKD. Time to see our number 1 now. The incredible remedy that can save your kidneys from proteinuria is number 1, cordyceps. This little fungus you see here is one of the most powerful remedies on earth when it comes to kidney health, according to science. In a review of 22 studies on cordyceps, almost 1,000 CKD patients were found to have significantly lowered their creatinine levels, improved many other markers of kidney health, including hemoglobin and serum albumin levels. This basically means an all-around improvement in kidney health and kidney function. And as we have seen, they reduce their proteinuria or ECR levels by more than a third in just 3 months. Incredible! Now guys, what you should know about cordyceps is that this is not your usual herbal remedy. This is actually a parasitic fungus that actually turns ants into zombies to grow. And while taking it as a remedy is pretty safe, there are some precautions you should know about. I've explained all you need to know to use this remedy in my video up here. Today we will see how to use an incredible little known remedy to repair your kidneys. Now guys, as you may already know, I don't like recommending exotic supplements for kidney health. I've been working with people suffering from kidney disease for almost a decade now, and I know that safe and sound always beats experimenting with herbs. And yet, there is a reason why I firmly believe that you should get informed and eventually start using this powerful adaptogen if you suffer from kidney problems. You see, in China, where this remedy is born and still used today, they don't use dialysis as the only therapy for kidney failure. They use cordyceps to prevent it. And well, it works! In China, doctors give this powerful remedy to patients in any stage of chronic kidney disease, stage 5 included, as a part of a combination of remedies called Shen Shui Ning that literally translated into kidney medicine. There are studies conducted with the Western scientific method to prove that the Chinese approach at treating kidney disease really works. In this study, stage 4 CKD patients lowered their creatinine levels by an incredible 18.3% in just 3 months of cordyceps supplementation. And guys, the Chinese are not all crazy to be using this remedy to avoid dialysis. Science says it can actually lower creatinine levels pretty fast, with results showing up in blood works in just 3 weeks in most cases. This is because cordyceps extract has very interesting properties in fighting inflammation, lowering cholesterol levels, and in reducing fatigue. It also contains a special type of sugar that can lower blood glucose levels in those with diabetes. For all these properties, it was actually tested several times in rigorous scientific settings. In a review of 22 studies on cordyceps, almost 1,000 CKD patients were found to have significantly lowered their creatinine levels. Now, these patients were not on dialysis and were still following the prescribed therapies for kidney disease. So, these patients greatly reduced their creatinine levels, reduced proteinuria, and also hemoglobin and serum albumin levels. This basically means an all-around improvement in kidney health and kidney function. And guys, when we talk about CKD, we are talking about a chronic, progressive disease. So the numbers in the analysis like creatinine, GFR, proteinuria are supposed to become worse over the years. Cordyceps is a remedy that has actually shown the possibility of changing this and making the kidneys gain back their function over the years. And guys, today I also want to show you exactly how to use cordyceps to improve your kidney health. The problem here is, it's not that easy to find a supplement containing real working cordyceps extract. What you should know about this remedy is that even if this is considered an herbal remedy, this is not actually an herb. Cordyceps actually is a parasitic fungus. Yes, This is not your everyday fungus. It's pretty incredible how this thing reproduces in nature, to be honest. As we can see here, this fungus can actually turn ants into zombies, make them go out of their path, and then it uses them as host. Yes, it's as frightening as a sci-fi movie, but it's real. And while almost all the supplements you find are cultivated on rye, rice, etc., so they don't actually come from ants of the Chinese forests, you should still be very careful with the brand you choose. Always find a brand that can certify the cordyceps content of its product. Now, this supplement is pretty popular and there are several brands selling it, so you should be able to find it pretty easily. If you can't, there is a link down in the description with more details. Very important. What's the correct dosage and how should you take cordyceps for kidney health? If you want to try cordyceps or any other innovative remedy, be sure to talk to your doctor first. And also buy a high-quality cordyceps supplement which can guarantee cordycepin and adenosine percentage. In one of the most complete studies on cordyceps for CKD, researchers were able to isolate what components of the cordyceps can treat kidney problems. The main thing you want to look for here is cordycepin. If the producer cannot certify cordycepin percentage, don't bother with it. The dosage commonly used in human research is 1,000 to 3,500 milligrams per day of extract. In several studies, patients took these dosages for years without significant side effects. Cordyceps extract is safe, but it may interact with immunosuppressants taken by people with a transplanted kidney. And guys, did you know that there is only one type of dietary fat in the world that's actually gonna help you repair your kidneys? This is the only dietary fat in the world that can effectively help slow down kidney disease progression in patients in the advanced stages. Catherine from Double Kidney here. Welcome to our journey together to a better kidney health. What I want to show you today is the healthiest dietary fat on earth. There's evidence that this fat can help with high blood pressure, one of the leading causes of CKD, and also cholesterol levels, triglycerides, inflammation, and more. During long-term double-blind clinical trials, this supplement has also shown to significantly slow down the progression of chronic kidney disease, even in the advanced stages. This fat is so healthy, I actually take it as a supplement every day. It's great for your body and mind. It can fight high cholesterol, depression, and anxiety, but also heart disease, metabolic syndrome, age-related mental decline, joint pain, sleep problems. It can even help prevent cancer. So, what is the best dietary fat in the world for the health of your kidneys? I'm talking about omega-3 fatty acids. Yes, this is one of the few supplements I actually take every day because, well, it actually works as advertised. Supplementing omega-3s is especially good for the health of the kidneys. It can protect them from the dangers of high blood pressure. It fights high cholesterol levels. There are even studies suggesting that supplementing omega-3s is a valid strategy to fight proteinuria, which is linked to kidney damage. Now guys, I'm not here to sell you supplements. There is no link down in the description to purchase omega-3s. Instead, I want to show you the reason why omega-3 fatty acid should be supplemented by basically everyone. And I will also show you exactly how to find the best brands for omega-3s by yourself. And guys, what you may not know yet is that the dose really makes the poison when it comes to supplementing this essential nutrient. Recent research confirmed that you really need to tailor suit your omega-3 intake if you want to benefit from it. When it comes to nutrition, more is not always better. This is especially true for people suffering from chronic kidney disease, high cholesterol levels, or high blood pressure. I'll show you the exact dosage for this supplement in a moment. Before that, an even more important question needs an answer. Can you really use omega-3s to repair the kidneys? Omega-3s are polyunsaturated fatty acids that are needed by the human body for many essential functions, as they are an integral part of cell membranes throughout the whole body. Simply put, your body doesn't work without enough omega-3s. Now, the human body can make most of the types of fats it needs from other fats or raw materials. That isn't the case for omega-3 fatty acids. These are essential fats the body can't make them from scratch, but must get them from food. Omega-3 deficiency can cause symptoms as severe as arthritis, depression, and even heart problems. Now, the Western diet isn't usually rich in these essential fats, but it is, on the other hand, rich in omega-6s. They are not very healthy. An imbalance between omega-6 and omega-3s can even cause inflammation, cardiovascular and kidney problems. And omega-3s are mainly found in fatty fish and in smaller amounts in nuts, especially walnuts, flax seeds, flaxseed oil, and chia seeds. Yes, omega-3s are not very easy to get in a renal diet. This is why I recommend supplementing them. Omega-6, on the other hand, are plenty in many processed foods and vegetable oils. This makes it pretty hard keeping omega-3s and omega-6 in balance without using supplements. So, question: do you actually need to supplement omega-3s? If you don't eat enough sardines, salmon, chia seeds, and flax seeds every day, a supplement may be really beneficial. When choosing a supplement, look at the EPA and DHA content. EPA and DHA are the fatty acids present in omega-3, the active components of fish oil. Look for a brand that contains at least 600 milligrams of combined EPA and DHA for 2 pills serving. The recommendation for healthy adults is a minimum of 250 to 500 milligrams combined EPA and DHA each day. This is the bare minimum everyone should be getting every day, not to incur in symptoms of deficiency. We can also take a higher dose to have even more benefits. There are studies showing that taking around 1000 milligrams of omega-3s every day can treat heart disease and protect the kidneys from high blood pressure. If you want to lower your cholesterol levels, you should up the dose to 2000 to 4000 milligrams a day. Now guys, as we can see here, 3000 milligrams a day is the maximum dose considered safe by the FDA. This is a supplement everyone should take and it's 100% safe. Still consult your doctor before starting to take it in any dose, but especially if you plan to take it in doses of 3000 milligrams a day or more. But this supplement is so powerful. As an anti-inflammatory, it was even used to treat patients with CKD in the advanced stages caused by IgA nephropathy. This is an inflammatory condition. Another study found out that even those suffering from pruritus caused by kidney disease can benefit from supplementing omega-3s, which is frankly amazing. I mean, is there anything omega-3s cannot do for your health? While you may think this is one of the most powerful supplements you can find, there is actually one thing that's even more powerful than omega-3s when it comes to improving kidney health. Do you want to know what it is? My video up here has the answer. And this is all for today. Thank you for watching.